protest is billionaire businessman who founded Phones for You, John Caudwell. Good morning to you, John.
Good morning.
Dr. Hillary alongside you as well. Your family has been sort of struck down by this disease. Who in your family has got it?
My family and thousands of other families, which is the exceptional thing that I've found about this illness, that it's not just one person that got a tick bite and suffers. It so often runs in families, huge numbers of families, with many members of the family infected.
But in your family?
My family, 11 members. But then 6 other people that are very closely associated to this. So I don't want to suggest, of course, that's a factor in that, the association. But what I suggested was that Lyme disease is absolutely rife. And when you've got somebody like me that understands the symptoms and can diagnose the symptoms, and then suggests somebody goes and gets tested, often they've got Lyme disease without knowing it.
But John, I mean, we're told, look, it's bacterial, it comes from tick bites. Did any of your family or you get bitten by a tick? How did this start with your family?
One of the great problems with it is that the ticks are very virulent when they're the size of a pinhead. It can be anything from the pinhead tick right the way through to fully grown tick. A little pinhead tick can sit on your skin for a day perhaps, unnoticed, and you might never notice. You might just have an itch, brush it off and it's gone, and you never know. You don't get the rash often, so there's no other symptoms other than maybe a few days later you start developing flu.
But did all your family, do you think, get bitten by ticks?
No,
or do you believe there's another way of transmitting that people here just haven't recognised or identified?
Absolutely I do, yeah. I mean, I've no doubt whatsoever that there's other methods of transmission. I don't know what they are.
Your family's passed it to each other, basically?
I don't know, but it's a distinct possibility. You know, this is what needs researching by the government. It's why I've been campaigning with Jeremy Hunt, and I was with Chris Whitty, the chief scientist, yesterday. I'm campaigning to try and get this understood. All I would put to anybody out there listening to me is that my ex-wife had got it, all my children have got it, my partner had got it, everybody in our family, or not everybody, virtually everybody has Lyme disease.
Are they diagnosed with Lyme disease by people in this country?
No.
Or have you had to go elsewhere?
That's another problem. And just in a nutshell, what we've got is sufferers all over the country that have had maybe 10, 15 years of Lyme disease symptoms. I can't say it's Lyme disease, I can say Lyme disease symptoms.
Which are what?
It's too much to go into in this programme, but if you can go anything from Lyme carditis through to gut trouble, to migratory arthritis, to depression, anxiety. It attacks, I mean, it's a bacteria that can drill into all the tissues, drill into your brain. It can get anywhere in your body to cause whatever destruction. I've seen people that within 3 months of a tick bite, and you normally call that acute Lyme, not chronic Lyme, within 3 months of infection, have been completely paralysed from the neck down. They have the antibiotics, and I'm not advocating antibiotics as the only treatment by a long way, but they have antibiotics and they recover.
Hillary, you're a doctor, you're listening to all this. This flies in the face of everything we understand about Lyme disease, because we've assumed before each individual who gets infected is getting it from a tick bite. This can't be the case with this family, for example.
But it's an interesting theory, and it needs to be explored, because there's a great deal that we don't understand about Lyme disease. I've seen patients with severe debility from Lyme disease, as John has seen in his family. And whilst there's no evidence that it's transmitted in any other way other than through tick bites, we need to look at it, because certainly there are things that don't always add up.
And John, I mean, one of the saddest cases in your family, your son, who's 21 now, but was afflicted at the age of 11. You say he went from a charismatic, bright, outgoing lad.
He was absolutely amazing. He'd jump on stage at my charity events, or 2,000 people, impromptu sing, belt out songs, the most charismatic, confident lad, and then he was just struck down. And his life changed from that moment on. He developed anxiety, depression. He went from being confident and outgoing to withdrawn and agoraphobic. And all of that within a few months. That was impossible then to treat. And all the psychiatrists and counsellors, they all suggest, they didn't really know why. And we had all sorts of treatments, but nothing ever worked.
But a blood test
it was a stroke of luck, really, because of work I'm doing with my autistic charity. And I met some doctors, and we started talking and exploring different aspects of autism and what might cause it. And it's a long story, but the connection there was that it caused me to look at a different cause for Rufus's illness. I had them look at him. We had him tested, and sure enough came back positive for Lyme, Bartonella, and a whole range of other associated illnesses. And that was the start then of me
See, here, this is a crucial point. But where was that testing done?
That was done in Germany.
Right. In Germany, over here it's 3,000 cases a year. In Germany, 250,000 are diagnosed. They're clearly identifying massively larger numbers of their population, which is not hugely different to ours, with Lyme disease. Our testing is surely has to be improved.
Their diagnostic criteria are different to ours. They're more aware of it, as they are in the States. They're doing more testing. Patient awareness is greater, and we need to catch up. The kind of testing they're doing is very similar. And if people are worried today, what I would say is this, that whilst we are still confused about how to treat it best, I would say prevention is really important. The summer's coming, the grass is growing, people are camping and hiking. What can you do to prevent a tick? What do you do if you get a tick bite? Well, if you've got a tick in your skin, you get some very fine tweezers, and you go as close to the skin as you possibly can, and you just gently pull steadily, not twisting and not crushing, just to remove that tick as best as you can. The next best thing is prevention. So if you're going hiking or camping, you wear long sleeve shirts and trousers, your trousers tucked into your socks, you put permethrin on your clothes, you take your clothes off before you go indoors, and you wash those clothes carefully, and you check your pets for ticks, and you get rid of them as much as you can, because that's prevention is going to be much easier than getting this treated.
And John, I know you're at Westminster today, aren't you, as part of this protest?
Well, I was with Chris Whitty yesterday, and incidentally, just on that point of testing, Chris Whitty told me yesterday, and I was at Ripple as well, the imported pathogens lab the other week, and they all assuring me that these tests are absolutely bona fide. But the problem is that what they'll only test for and give a positive is when it's absolutely undoubted. The other labs, they say, give a lot less sensitivity, in other words, a lot less accurate. And therefore, from labs in Germany, you get 90% positive. From the lab at Ripple, the UK lab, you get 10%. Somewhere in the middle is the truth.
Yes.
But we're undiagnosing hundreds of thousands of people. The Germans might be slightly over-diagnosing. I'd rather be over-diagnosed when I've got the clinical symptoms and then look at treating.
John, we've got to leave it there. Thank you very much for coming in. It's a very important cause. We've got to get to the bottom of this, I think.
Well, the Department of Health says they are commissioning 3 reviews on the diagnosis, treatment and transmission of Lyme. They said they want to work with a variety of Lyme disease charities and organisations to try and develop a way forward.
Well, the mere fact they're doing that, I think, suggests how seriously they're taking it. Thank you very much again. Coming up, we've got a